main themes. One is we're now reevaluating data in terms of low-dose tamoxifen in early-stage breast cancer patients with ductal carcinoma in situ and patients with precursor lesions. And in a recent paper they just presented at ASCO today, they showed a reduction in the risk of recurrence in these patients as well as invasive breast cancer with low-dose tamoxifen. So it's another affirmation of the data that we already received previously. So I think one in early-stage breast cancer is the lidERA trial. It's an over 4,000 patient population, which was both pre- and postmenopausal, slightly more on the postmenopausal side, all estrogen-positive breast cancer patients that are early stage. We're evaluating the efficacy of a new agent, which is an oral SERD, or an estrogen downregulator. And this is a selective downregulator called giredestrant, which is one of the first of its kind in the early stage setting of breast cancer. And we're seeing both disease-free survival benefit as well as a reduction in recurrence in patients that are with the use of this agent in comparison to standard of care. One of the abstracts, the LBA4 abstract, which is looking at Selpercatinib in the RET mutation positive patients, stages 1B to 3A, they evaluated over 400 patients and they showed an improvement in disease-free survival in these patients as compared to placebo after initial resection of the lung cancer. That this is a very interesting trial that also is reevaluating Ivonescimab in the first-line setting in comparison to immunotherapy, and we're showing a statistical benefit here in terms of overall response and progression-free survival with Ivonescimab, which will also be now presented at the plenary session today. This will also give us better indication and understanding of a biclonal or bispecific antibody that's going to trigger both the immune system and VEGF, and how that will lead to ultimately changing practice as we continue to evolve in the landscape of treating primary lung cancer in the first-line setting in metastatic disease. So I think number one is we'll have a new treatment on the horizon, which is the oral SERD molecules, which will now be competitive not only in the metastatic setting, but also in the adjuvant setting, awaiting FDA approval. The other thing is utilizing ctDNA both in early and later stage breast cancer. And then there will be abstracts that will be presented this year that we're waiting to see as well, which will be artificial intelligence and how they will guide current treatment and how they will compare to how we treat patients using Oncotype, and ultimately guiding prognostics in these patients as well.